Welcome to this explainer. Okay, so if you've recently had weight loss surgery, I bet you're obsessing over one massive question. What are the absolute most important foods to eat? You're probably staring at these grocery lists full of lean turkey, spinach, and cottage cheese, just trying to build that ultimate post-op meal plan. And honestly, getting your bariatric diet dialed in is absolutely the foundation of your long-term health. But as we're going to see today, the honest answer about the best foods is a whole lot more nuanced than whatever you'll find in a standard surgical discharge packet. Getting this right matters so much, especially in those critical first 12 to 24 months of recovery.
Before we start mapping out those healthy meals and perfectly portioned grocery lists, we have to address a critical question. And this is one that could literally make or break your lifelong recovery. We all kind of assume that if we just pack our plates with the right, clean, protein-rich foods, the absolute most important foods to eat, our bodies will just handle the rest. But what if I told you that a perfect diet is actually not enough? Seriously. Bariatric surgery completely changes the rules of the game.
Let's dive into our clinical roadmap for today. We're going to cover the food alone myth, the anatomy of the absorption gap, the hidden nutrient deficiencies, generic vitamins versus clinical needs, avoiding common clinic mistakes, and finally, we'll wrap up with the non-negotiable daily protocol. All right, section 1, the food alone myth, why a perfect diet is an illusion post-surgery. This right here is a massive misconception, and it trips up countless patients. While eating healthy, nutrient-dense bariatric foods is absolutely crucial, no doubt about it, 20-year veteran nutritionists emphasize that relying solely on food is a dangerous mistake. Why? Well, because it fundamentally ignores how your body has changed. Think about it. You can eat the most nutrient-packed meal in the world, salmon, kale, lentils, the whole shebang. But if your body can't process those amazing foods the way it used to, you are going to fall dangerously short. Moving right along to section 2, anatomy of the absorption gap, the structural reality of your new digestive system. So the key takeaway here is that failing to get enough nutrients post-op, it is definitely not about a lack of willpower or making bad food choices. It's a permanent structural issue. Surgery fundamentally alters your anatomy through a triad of physical changes. First off, your new, smaller stomach pouch drastically reduces the physical volume of food you can even eat. Second, your intestinal absorption surfaces are bypassed or altered. And third, you have a significantly reduced acidic environment. It's kind of like your old digestive system was this long, slow conveyor belt in a factory. Surgery has permanently shortened that belt and, crucially, removed the chemical workers, meaning your stomach acid, that are needed to unpack the nutrients from your food. Because of this, your body literally cannot extract enough nutrients from even the healthiest bariatric foods list. Which brings us to section 3, the hidden nutrient deficiencies. What happens when the absorption gap is ignored? If we just ignore this gap, the consequences are genuinely severe. Listen to this alarming stat. A staggering 30% of gastric bypass patients develop a severe vitamin B12 deficiency within 24 months if they aren't using a bariatric-specific formulation. And you know what the really scary part is? You won't feel it on day one. Nope. Crippling symptoms like hair loss, brittle nails, and crushing brain fog, they sneak up on you like a time bomb, usually detonating right between months 9 and 18. And this perfectly illustrates an even wider threat. You could be eating the most iron-rich diet possible, lean beef, dark leafy greens, whatever you want, but up to half of all patients will still suffer from iron deficiency within 2 years if they attempt to rely on diet alone. Half. And let me be clear, this isn't just feeling a little bit tired in the afternoon. This is full-blown new anemia. Oh, and by the way, vitamin D insufficiency is nearly universal, and a thiamine deficiency can actually pop up within weeks if your intake is inadequate. Let's look at section 4, generic vitamins versus clinical needs. Why grocery store brands fail post-op patients. This is exactly why the ASMBS clinical guidelines insist on lifelong bariatric-specific supplementation. A standard generic one-a-day vitamin from the grocery store simply isn't going to cut it. For example, regular multivitamins use calcium carbonate, which requires that stomach acid you just don't have enough of anymore. Specialized clinical formulas, like Bari Liquid Force, use calcium citrate, which your body easily absorbs even without that acid. Also, regular vitamins might offer 6 to 25 micrograms of standard B12, but your actual clinical need post-surgery is 500 micrograms of bioavailable methylcobalamin. That's a massive difference. Plus, swallowing hard tablets can be super unpleasant on a new pouch, whereas liquid-filled gel capsules go down so much easier. It's really all about delivering all 29 bariatric-specific nutrients in the bioavailable forms your newly altered stomach actually requires.
All right, moving into section 5, avoiding common clinic mistakes. Pitfalls that sabotage your recovery.
After 20 plus years of bariatric counseling, professionals see the exact same costly errors repeated over and over. One of the absolute biggest is waiting until that 4-week follow-up to start taking vitamins. Actually, scratch that. You need them starting on day 1. Another huge pitfall, thinking you can just stop your vitamin regimen once your weight loss stabilizes. Honestly, that is exactly when those hidden deficiencies start creeping up on you. Also, taking your iron and calcium at the exact same time, it's literally like putting a lock on a door and throwing away the key. They actually block each other from being absorbed. And finally, please, never brush off early symptoms like fatigue or irritability as just part of the surgery.
Which leads us perfectly into section 6, the non-negotiable daily protocol, a boring, repeatable, and resilient routine.
To survive the everyday chaos of real life, you've got to establish a concrete system to get all 29 essential nutrients in daily. Think of this highly practical morning mandate as the ultimate insurance policy for all those healthy bariatric foods you're going to be eating later in the day. First up, take your capsules early in the morning with water, maybe anchor it to an existing habit, like brushing your teeth. Second, and I know this is tough for some of us, delay that morning coffee by at least 30 minutes so it doesn't mess with absorption. And third, strictly space out competing minerals. You really want to separate your iron and calcium intake by a minimum of 2 hours. Now, it is absolutely crucial that you adhere to this strict clinical timeline. Notice how it starts right on post-op day 1. Boom. Then, you absolutely must get your blood labs done at month 3, month 6, and month 12, followed by annual checks after that. Do not skip these. As any clinician will tell you, nutritional deficiencies are infinitely easier to prevent with careful lab monitoring than they are to try and correct once they've already taken hold of your body. So here is your golden rule. Consistency beats perfection. In actual clinical practice, the single biggest predictor of long-term health isn't having the most complex, flawlessly perfect diet. It's having a simple, genuine routine. A straightforward 2-capsule daily dose of a complete formula like Bari Liquid Force will always outperform those complex 6-pill stacks simply because you are actually going to stick to it. Consistency is the true secret to lifelong post-bariatric health. So, as we wrap up this explainer, I want you to think about this as you plan your healthy post-op meals and stock your fridge with the most important foods to eat. Ask yourself, are you still relying on the myth of food alone, or are you ready to commit to the daily protocol that actively closes your absorption gap? The choice is yours, but your lifelong health depends on it.